853, Ask the Expert, and Carol Barr is a registered dietitian and certified diabetes educator at Bronson Battle Creek Diabetes Education Center, and she's with us right now. Good morning, Carol. Nice to have you.
Good morning.
Well, let's start out just getting out of the way some definitions. What are we talking about exactly when we talk about diabetes? What is it?
It's when the body can't metabolize carbohydrate well. Sometimes that's called glucose intolerance, and could lead to, or maybe a lack of sufficient insulin or no insulin on board.
And I hear about type 1, type 2. What's the difference between those two?
In type 1 diabetes, there is no insulin present, and so that requires insulin all the time. In type 2 diabetes, it's usually associated with lifestyle. Patient is often overweight, inactive, and may have glucose intolerance um, and need medication, but they're not requiring insulin for life.
I see. And if we don't treat this properly, we hear a lot of different things, but I mean, basically, what's going to happen?
Well, the least thing would be that you didn't feel good,
Mhm.
and then diabetes untreated for a period of time would lead to complications of diabetes, which could involve blindness and amputations and kidney failure and death if untreated.
Now, of course, we've got Halloween just around the corner, and that means there's going to be candy everywhere. How does that relate to all of this?
Well, we always worry about it, I think, but I think that a good idea would be to capitalize on the fun of the event, and I think children do enjoy costumes and the trick or treating part, and I might, capitalize on that. I think some elementary schools still have a parade, and they can wear their costumes. But the dealing with candy is kind of an individual thing. If a child's diabetes was in good control, the parent might decide to allow a couple of pieces of candy a day or whatever, suits their management or keeps them in good control. But it's always, I mean, it is, very tempting because it's everywhere, the candy.
If somebody munches on candy all the time, are they at a higher risk for developing diabetes?
I think only if they have, it's a genetic kind of disease, hereditary, and
Hmm.
so if they had the tendency to get diabetes, it might push them over the limit. But if you didn't have diabetes in your future, eating candy wouldn't necessarily cause it.
When I was growing up, my grandma always had Heath bars on the shelf next to the refrigerator, and we were told that's off limits. You may not have it. That's because Uncle Vern has diabetes and he might need it. I never understood that.
Well, you can treat a low blood sugar with candy. It isn't our favorite choice, but that's probably what he was doing. If he had a low blood sugar, then if he ate candy, it would get his sugar back up until he could eat something more substantial.
Well, thanks for explaining that. I always wondered about that. Let's talk support programs at Bronson. What sort of programs do you offer people with diabetes?
Well, we have a diabetic education class that starts most Mondays. We also do individual instruction and include follow up at intervals. We have a monthly support group. We have a pre-diabetes class and a walking group. And on November 9th, we're going to, along with the Wound Center at Bronson Battle Creek, we're going to have a foot clinic,
Now,
to mention a few.
getting back to type 1 and type 2, I take it type 1 is not reversible, but if people are on the borderline with type 2, can they reverse that?
They think that you can. The CDC says that with 5 to 7% weight loss and increased activity, you could reverse the trend or certainly slow the trend to developing type 2 diabetes.
Well, when you consider the alternatives, that seems like a good idea.
Well,
So,
it would save a lot of money and hardship. If you could avoid diabetes or certainly put off the having to take medications and deal with complications of diabetes.
Sure. A lot of times we're literally talking life and limb with this
Right.
disease.
Yes.
So, if we'd like to sign up for some of those educational opportunities through Bronson, what should we do, Carol?
Call the Diabetes Center, and the phone number is 245 8190.
245-8190, and you can get signed up today. Well, Carol Barr, we really appreciate you being with us. She's a registered dietitian, certified diabetes educator at Bronson Battle Creek Diabetes Education Center. We'll talk to you again soon, okay, Carol?
Thank you so much.
Yep, thank you.